Hi, good evening to all the parents out there. Big hello, good evening from India. I'm Dr. Nandini Gokulchandran, and I head NeuroGen Brain and Spine Institute, and I'm happy to share what our experiences in various modalities for the treatment of conditions, neurological conditions like autism and cerebral palsy, and the holistic approach is what we are looking at. So let's look at what are the recent advances and what can we do for our children. There is a lot of information out there in the internet. And what I'm trying to do is try and get together what works good as a combination, because we believe that to to help any child with a neurological condition like autism or a CP, it is important to have a multi-pronged approach, a teamwork which will work in harmony with each other. So that's what our experience is, what I will be discussing with you. Uh, I learn a lot from parents, discussing with parents when they come to us for treatment or when they come for a consultation, and consider this to be like a give and take too. I would feel free to put in your inputs into the on the chat box in your questions there as the presentation is happening. At the end of the presentation, I would read out all your inputs, comments, opinions. Be as frank as you can be, and I'm happy to be honest with you. So going on to the next slide. Anyway, why are we here? We are here because either we have a child with special needs, more or neurological condition, or we are a professional or a therapist or a caretaker of such a child. We want to know what is out there in the world which can help our children. What are the current treatment paradigms for a neurological condition, or for any malady or condition, or in the field of medical science at this point? Number one, you are told for a neurological condition that there is no cure. That is what you keep on listening to since your child got diagnosed. So you go from one place to another, and this is a common thing that you hear from everybody, that there is no cure, that there is no surgical intervention, there is no tumor, there is no pressure symptom that surgery can help and quickly fix it. So no surgical intervention. There is only rehabilitation. So all your life you have to keep on doing rehabilitation. Parents come and ask me, how long do we have to do this? How long do we need to do sensory integration, and how long do we need to do occupational therapy, and how long do we need to do speech therapy? So what you are told is that there is no cure, there is no surgery, there are no medicines or quick fix. There is only rehabilitation. Keep doing rehab, and there are no medicines. Yeah, so it's not a fever or a cough or cold which with antibiotics or medicines can be treated. So no cure, no surgical intervention. Rehabilitation is the only thing that you have at this point, and there are no medicines. So what is new that is possible? What is new is, along with rehabilitation in the center, we have cell therapy to assist this rehabilitation, and we have integrative therapies. Sounds very interesting, isn't it? Integrative therapies, which integrates in very seamlessly into cell therapy and rehabilitation together. So this combo, this combination, it works beautifully. If rehabilitation gives you 20% result, for example, cell therapy gives you 20, integrative on its own gives 20, together you will get more than 70, 80, 90. So that's the outcome, or that's the effect of a combination approach. So for example, if you have a fracture in your leg, you must have at some point experienced a fracture in your life, or had one of your dear ones. Fractures are very common in elderlies, and even young people who are very rash in driving here and there, even cycle. Sometimes children fall down and have a fracture. What do? We all know that we don't just start walking with the fracture, right? We would fix the fracture. And once the fracture is fixed, then you start doing the training rehabilitation to strengthen the muscles. Then you are able to walk. What will happen if you walk with a fractured leg? What will happen is that the fracture will worsen. So similarly for the brain, right? Just as you can see here, this is a PET-CT scan of the brain. I will explain to you more later. You can see that the blue areas here are damaged, and once the damage or the low functioning is taken care of, the brain starts functioning better. Now the rehab, the training, it becomes more effective, and that's why we suggest a combination. So the old thinking, old means like really about 30, 40, 50 years back, it was thought that the central nervous system or even the peripheral nervous system is incapable of regeneration. However, a long time back, this dogma or this old thinking has been refuted. It has been found that there are niches in the brain which continue to multiply lifelong. This continue to form new memories. Hippocampus, the part of the brain which is important for cognition and learning, creates new memories every day. We develop new relations every day. We meet new people and we form connections, and the brain learns every day. So it is possible to regenerate. And now with the concept of cellular replacement and repair, this possibility of regeneration becomes more evident. And we now know that it is possible to regenerate brain, and we are seeing the evidence every day. We have been seeing it for the last 14, 15 years now. So cell therapy is not it's not a science fiction. It is an idea whose time has come. It is right now, right here. It also helps children who are on the wheelchair, who have never held their neck, who have never been able to sit, to be able to sit and walk. So it's like a stem is like similar to a stem of a tree, right? You put a seed and you put water, fertilizer, and here comes out a small, a very new sapling, right? And then the leaves come out, and then the flowers and the fruits. And that's how the stem cell also works. Similar to that, that's how the analogy is. So this is a stem of a tree and gives rise to branches and leaves and flowers and fruits on giving proper growth factors and fertilizers. And this is what the cells are going to do. There are different types of transplantation because we are going to put it in another place. When we take from our own body and put it back in our own body, it is known as autologous. When we take from somebody else and put it in our body, it is known as allogenic. When we take cells from a donor. What capacity do these cells have? These cells have the capacity, these are special cells, capacity to multiply and then repair and replace and regenerate. If you put them in the liver, they can form liver-like cells to stimulate the liver to function better. If you put them in the heart, they can help the heart to repair. If you put them in the joints, they have the cartilage and the joint cavity to become more flexible. If you put them in the skin, it can help wound healing. And you put them near the brain, it helps the brain to repair. This is Stephen Hawking. I hope you can see this video. He's talking about the power of our own body.
I have spent my life exploring the mysteries of the cosmos. But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness. All because of cells inside us, which
have special powers. They are called stem cells.
Just hearing his voice gives me goosebumps. And all of you know about this very, very renowned scientist, Stephen Hawking. He unfortunately is no more, but he was a Nobel laureate. He himself was suffering from a neurological condition known as amyotrophic lateral sclerosis, commonly known as motor neuron disease or ALS. And he spoke about the possibilities, immense possibilities of your own body's regenerative capacity to heal your own body's maladies. And that's what exactly is what we are doing. So how do these cells work? What do? They multiply. That is one of their characteristics. One cell will multiply into hundreds and thousands of cells. Thereby, with a small dosage of cells, you can have a longer and bigger effect. Second is convert into other type of cells. So these cells can convert depending on what kind of environment we give them, what kind of signaling that we give them into. They can convert into blood cells, they can convert into muscle cells, they can convert into cartilage, into nerve cells, into heart cells. And this is an example of the bone marrow cell converting into a neuron-like cell and connecting with each other. Very importantly, they release growth factors. They release myriads of growth factors and cytokines, which will help reduce inflammation, which will help stimulate blood supply, will stimulate release of growth factors, and thereby stimulate neuroregeneration and repair. Okay, so it's like in a classroom. I can always give an example. In a classroom, you have so many children, sitting together. Some are very intelligent, and some are not so intelligent. So earlier, when we were kids, our teachers would pair up a very intelligent child with an average child, so that the intelligent child's, intelligence or the dedication or the focus rubs off on the average child and helps improve performance. And that's called the paracrine effect. So similarly, the cells that we put in will go and stimulate the cells which are inactive or which are sleeping to be able to work better. Improves blood supply. Everything is about blood supply, isn't it? So when you have a wound in the leg, what happens? Suddenly that area becomes red. What does that mean? There is an increase in the blood flow, and with the blood flow comes the oxygen. With the blood flow comes the reparative chemicals which help repair that wound. Even if you don't do anything to the wound, 70-80% of the time the wound will heal by itself. Only you have to keep it free from any infection. Right? So that's how these cells will do improve blood supply in the brain. It's called neoangiogenesis, formation of new blood vessels. So what is the concept of cell therapy? Okay, the concept is like this. Way back in 1990, you had a torch to see light. Okay, you had a computer or a PC at your home to do your work, whatever you do on a computer, right? Then you have a calculator, which is separate. Then you have a camera, which is separate. Okay, then you have a video, a camera, which is separate. You have a phone, which is different. You have an iPod, you have a television, you have books. But now, in the 20s, what do you have? You have an Android or iPhone, right? It does all of these works. You can watch television in it. You can watch YouTube in it. You can read books on it. You have a torch in it. You can record short films on it. You can take amazing pictures. You have a calculator. You can do surfing, all in one. And that's the concept of cells. The cell is like a drug delivery system, okay? And it has multiple actions. Instead of giving 10 drugs together, you have a cell which does all of these actions. And that's what it does. What do cells do? These special cells have immunomodulatory effect. They reduce inflammation where required. They help attract the cells which are required to repair. They are antioxidant. Most of the conditions that we have, including autism, is at the cellular level, it is supposed to be about oxidative stress. Too much of oxidative stress leading to damage of the cells. A lot of parents come and talk to me about mitochondrial dysfunction. What does mitochondrial dysfunction ultimately mean? That means that the breathing capacity of the cell, the respiratory capacity of the cell is not adequate, leading to more oxidative stress. Okay, anti-apoptosis, that is, it prevents death of the cell and increase blood supply, formation of new blood vessels. Okay, so this group of cells can do all of these actions. So you don't. So, for example, antioxidants, you give a lot of antioxidants and multivitamins and medications, isn't it, to your children? Some parents, in fact, give about 40 different pills to their children in the hope that, all these actions will happen. And cells themselves have all of this in one place. Okay. So now, what are the different types of stem cells that we know. We know embryonic stem cells. Okay, when we were a child, or when we were in our mother's womb, when we were conceived, we were a one cell stage, and then from one cell you become 2, 4, 8, and you become a bunch of cells. And as these bunch of cells, they differentiate and form. You can see here these stem cells. These are known as embryonic stem cell. They have the capacity to become any type of cell in your body. However, they also have the characteristics of becoming a tumor, because they can become any type of cells. If you just leave them like that on a culture plate in a laboratory, you will see these bunch of cells which are like this, and you will see some cells pumping hard there, and you will see some hair growth there, and you will see some teeth there. So that means these cells can, really differentiate into teratomas. These are benign tumors having all different tissue types in it. So hence, using embryonic cells for medical transplantation or clinical transplantation is currently not a feasible option. So it's a big no-no for treatment. Then we have what you commonly known as cord blood stem cells, right? Cord blood is when I say that I'm in the field of regenerative medicine and stem cell, people ask me, oh, cord blood. So that is a very commonly known or understood these days, or lay term for stem cells. So cord blood is the cord connects the mother and the child and sends all blood, oxygen, all the nutrients to the child as the child is growing in the womb. And when the child comes out, we cut the cord, right? So this cord contains a lot of immature multiplying cell which have the potential to become a whole lot of different types of cells. So it's a very rich source of stem cells which can be stored and used later. Currently, the use of cord blood cells is more localized to blood disorders or hematopoietic disorders. So what do we have now? The third type is the adult cells or adult stem cells. These are cells in our own body. We can take it from the bone. We can take it from the fat. Even our teeth have certain types of mesenchymal cells. Those which are our the molar teeth or the wisdom tooth or the milk tooth of a child has a lot of cells. But the most commonly studied is the adult stem cells from the bone marrow. Bone marrow cells have been used for years together for transplantation. Okay. Now, the fourth type is the induced pluripotent stem cell, is a designer stem cell for which has been Nobel Prize has been given in 2012 from our own cells, from our skin cells, which are maybe 30, 40, 50-year-old. The DNA can be converted into by stimulation into a childlike cell or embryonic cell, and then it can be differentiated into a retina or a platelet or a red blood cell. So that is still in a lot of research, and hopefully soon we will find a breakthrough there. But what we have today is the adult stem cell, because it can be taken from our own body. There are no teratoma formation, there are no ethical issues, and it is safe to be used in our own to repair our own body, just as Stephen Hawking had said. So when commonly you go to any doctor or any medical personnel and you talk about stem cells, they say, oh, it is banned. It is banned by FDA. It is not so. So you have to be able to differentiate the stem cells. Okay, so what you are doing is basically saying that alcohol and homemade orange juice are the same, because these are both drinks. But there is a difference, isn't it? Alcohol is like the embryonic stem cell, while adult stem cells taken from our own body is the homemade orange juice made by mother with lot of love. Okay, so that is the adult stem cells. That's the difference. So we prefer using adult cells in clinical setting because these are safe, these are non-tumorogenic, there are no rejection issues, they are easily obtainable, and there are no ethical issues. So we take cells from the bone marrow, separate what are known as the mononuclear cells. So strictly, they are not one type of stem cells. They do contain cells which can multiply and differentiate, but these are a group of cells or a cocktail of cells, as we say, mononuclear cells. And these are injected into the spinal fluid. You can see that the person is lying on one side and injection in the lower back after the spinal cord ends. So this cells will be injected into the spinal fluid, and this fluid will go all around the brain and spine and help go and home onto the parts which are functioning less or damaged. So why it's called intrathecal injection or lumbar puncture? Why? Because it's minimally invasive, it is safe, there are no major side effects. Cells will go into the injured brain tissue, no dilution in lungs, liver, or spleen. Because the other way that you can put in is through intravenous route. Putting through the intravenous route, the cells will have to travel through the vein into the right side of the heart, then pumped into the lungs, from the lungs to the left side of the heart, and then from there to the liver and kidney and the brain. So you can see that about 70 to 80% of the cells will get diluted or trapped in the lungs and the other organs. So a number of cells which actually reach the brain will be very little. So with intrathecal or putting into the spinal fluid, we are ensuring that maximum cells or all the cells go into the brain and spine vicinity. So what is cell therapy? Cell therapy is a branch of regenerative medicine, very promising, where once the brain is damaged or there is low perfusion or the cells are working less, these cells can be stimulated with special cells and help to function better. So what is the scientific basis? The scientific basis is there's a lot of work which has happened over the last 30, 40, 50 years. In 1990, the first time ever demonstration of stem cells in bone marrow received the Nobel Prize. Dr. Thomas E. Thomas received the Nobel Prize. In 2007, Sir Martin Evans received Nobel Prize for the isolation of embryonic stem cell in mice. And more recently, in 2012, Shinya Yamanaka and John Gurdon received the coveted Nobel Prize for the concept of induced pluripotent stem cells. As far as NeuroGen is concerned, whatever work we do is scientifically validated and published in international peer-reviewed journals. So we have published over 106 publications in different neurological conditions like autism, cerebral palsy, intellectual disability, muscular dystrophy, spinal cord injury. So about 16 publications in autism. Also, we've been invited to write book chapters in medical textbooks, the one named as Recent Advances in Autism, Stem Cell Therapy in Autism Spectrum Disorder, because of our expertise. Also, a book chapter in book known as Cerebral Palsy Challenges for the Future, Stem Cell Therapy in Pediatric Neurological Disabilities, in the book known as Physical Disability Therapeutic Implications, book in a chapter on muscular dystrophy. So how is the treatment done? The treatment is a very simple procedure. There are no cuts, there are no stitches. Bone marrow is aspirated from the hip bone using a very thin needle. The bone marrow is a hollow part of the bone which contains blood elements. So blood is formed continuously in our body in different parts of our bones, and this is the hip bone right here in the front. You can see the hip bone cells. The needle is injected here, not in the joint here. Okay, so the bone marrow is like a thick blood, and it is processed in the laboratory, and the processing is done in centrifugation. What we don't need, the red cells get deposited down, and what we need is this transparent white layer which is separated and then injected with a needle into the spinal fluid. So stem cell transplantation can be carried out in 3 ways: bone marrow aspiration, cell separation, and injected into the spinal fluid. You see bone marrow, this is the cell, this is the bunch of cell that will be diluted and injected. So let's look at the results in autism. We know what autism is. It is a neurodevelopmental disorder. So it's a condition where the brain development somewhere is affected. It could have started before birth, but it is evident around 1.5 to 2 years now. We are picking it up early of life, and it's a spectrum, so it can be mild, moderate, or severe. Generally triad of symptoms under which a whole lot of other symptoms are buried: poor social interaction, impaired communication, and restricted repetitive behavior or interests. This shows the statistics why it is important to find a definitive treatment for autism, because the numbers are increasing. If you see in 2004, it was 1 in 166, the prevalence. Now in 2021, it is 1 in 44, and recently 22-23 statistics is 1 in 39. So you can see that every 2-3 years, the prevalence is increasing by 10 to 20%, which is alarming. Almost 70 million people in the world are on the spectrum, which contributes to 1% of the world's population, which is huge. So parents keep asking themselves, what happened? Really, why did my child develop autism? What did I do wrong? So, it's a very difficult question to answer. No parent really wants to do anything to cause any harm to their child. It's just a more complex problem. It's generally a combination of genetic and environmental factors. Many people feel it's out and out genetic. It's not so. So there could be part genetic, part environmental, and sometimes it is a combination. Most likely it is a combination. Why do we say genetic? It's a possibility. Many times you see 2 children in a family, 3 children in a family, sometimes 4 in a family, sometimes more in the extended family as well. There are certain articles which suggest that sometimes there is a single gene phenomena, sometimes there is a multiple gene phenomena. A single gene would directly say, for example, in tuberous sclerosis or Fragile X syndrome, you know that this gene defect is causing the problem. However, many times a whole genome analysis may not really give you a very solid answer as to what could contribute to your child's condition. So it may not be that one gene, but that gene with the environmental factor may contribute. For example, a particular gene defect may be there in 4 people, but out of 4, only 1 may have autism. So what does that mean? It means that somewhere environmental factors are contributing. Hence, environment, we have to understand that the genetic factor, you may not really able to change the genes, right? You can't really change if you are a weak-skinned person or a fair person. You can't change the fact that your eyes may look different. It all is our characteristics that you get from your parents. But you can change the environmental factors by, if you are somebody who has tendency to put on weight, you can be more vigilant and exercise more and try to keep yourself thin and fit, right? So environmental factors are something that can be taken care of to some extent to improve the outcome of a condition. So what are the environmental factors that could cause autism? Prenatal and antenatal causes. We will look at a few: intestinal dysfunction, exposure to toxic chemicals in the environment, use of mobile phones. So to talk a little briefly about each, prenatal antenatal causes starts from mother's age, father's age. How is mother's physical condition, her hemoglobin, her vitamin levels? Is she ready for a pregnancy? What are the stress factors she's undergoing during the conception and pregnancy? Whether she's hypothyroid or she has diabetes or she's on medications. So a lot of these factors would affect the child's brain development. Intestinal dysfunction, though a lot of focus is on the child's intestine, but there is a phenomena known as maternal induced antibodies, or MIA, where mother's intestinal issues can lead to antibodies leading affecting the child's brain. So any inflammation in the mother's intestine may also cause child's dysfunction. Exposure to toxic chemicals in the environment, yes, there is a lot of contamination in what we breathe, what we drink, what we eat, sometimes, and what we are exposed to. So much of phone radiation, so all of these could affect the child's overall development. And along with that, use of mobile phone. Now, mobile phone is a controversial theory. It has not been completely validated. However, it is understood that if a mother, while being pregnant, uses too much of phone, the radiation may affect the child's brain development. On the other hand, when the child comes out, too much of gadget connection or too much of phone exposure prevents the child's socialization and thereby affects social connections and networking and communication, which adds on to the child's problem. So there are a lot of things. I think looking at all of these, one believes and one feels that our childhood was very simple, isn't it? So can we go back to our roots? I think our roots were very strong. We need to see how our parents brought us up. When parents ask me what should we do, I say, just go and ask your mother, just go and ask your father, how did they, bring you up? So I think going back to your roots makes a lot of sense now. Now to the scientific part, I briefly mentioned about PET CT scan when I was talking about fracture and brain damage, and a lot of work has been done on the PET scan of the brain earlier as well. And at NeuroGen, we have done a baseline study to see which parts of the brain is affected and what happens over a period of time as the age increases in a child's brain. So the MRI broadly tells us that the brain structure is fine, and it is important to know that. The PET scan tells us the functioning of the brain. So when you see this brain from the side view, you are seeing different colors. These colors are here to make our understanding more simpler. This is front of the brain, top of the brain, back and below. The blue parts here, you can see some light blue and dark blue and really dark blue. These are the areas which are functioning less. Darker the blue, less the functioning or less the metabolism. The green part indicates good functioning brain. Red, yellow, and white indicates more functioning. So these areas which are functioning less contribute to the child's symptoms. So let's look at what these areas are. Okay. The part here in the middle is known as the medial temporal and thalamus. The mesial temporal is hippocampus and amygdala. That means understanding, learning, comprehension, socialization, and emotional expression. So that all resonates, isn't it? The cerebellum is for fine motor activity, coordination, balance, articulation, chewing, swallowing. Most children just gulp their food, isn't it? So these together affect the development of the later part of the development of a child's brain or networking. This was published in the World Journal of Nuclear Medicine in the year 2018 by NeuroGen. What we also found or saw is that as this is the blue line indicates the development of a neurotypical brain, that the neurotypical brain develops very fast up to 10 years and then it continues to develop up till 15, but albeit a bit slowly. In a brain of a child with autism, you can see that the metabolism higher earlier. So many parents tell us, my child was extremely intelligent earlier. It was very responsive, and then there is a regression. So that's what is seen, that initially the brain development appears to be higher, and then around 2.5 you start seeing this regression. And as the regression happens, at one point the child, it continues to go down. So autism is not a static condition. There is a reduction in functioning as the age increases. So knowing now what is wrong in the brain, now we can think, whatever we are doing, is it enough? So what are we doing? We are doing a lot of rehabilitation and maybe medicines for hyperactivity or epilepsy. These are okay to manage the symptoms, but the rehabilitation helps whatever functioning the brain has to work better. But a big part of the brain is functioning less. We need to improve the functioning of that part to give us a better outcome. So overall, we find about 90% of the children that we treat showing improvement. Improvement is generally seen in better understanding, comprehension, learning, ability to be aware about what is happening around them, much more exploration, better emotional responsiveness, more trainable in activities of daily living, and eventually better communication, both non-verbal and verbal. The first ever publication which showed that cell therapy or stem cell therapy can help in autism came from NeuroGen from India. We should be proud of that. So there we, sorry. The second article, which is a follow-up of the same with 254 patients, came in 2020, was published in the American Journal of Stem Cells, where we looked at 254 children aged 2 to 34 with an average follow-up of 7.5 months. We did clinical assessments on CARS and Indian Scale for Autism Assessment and PET CT scan brain. What we found is that about more than 50% of children improved in their social interaction, a big part improved in eye contact and as attention, concentration, stereotypical behavior reduced, aggressiveness reduced in about 50%, hyperactivity reduced in about 60% of the children, self-injurious behavior reduced in adult patients, sitting tolerance improved in almost 70 to 80% of the children, command following improved, speech improved in 50%, and communication improved in 50% of children. So there were improvements in all different areas holistically. We found clinically the scores, the ISA and CARS scores showing significant improvements, meaning that there was a clinical shift in the child's performance from severe to moderate and moderate to mild. Based on the severity, both mild and moderate improved by about 93%. In terms of age, those who came to us less than 5 years showed the best results. About 97 to 98% of these children showed improvement. Between 5 to 10 years, about 94%. Between 10 to 15 years, about 90% of children. So as the age increases, the possibility of improvement reduces a bit. Males and females both improved almost to the same extent. So treatment works both for male and girls and the boys. Duration from diagnosis to intervention. So depending on how soon they came after diagnosis, children who came to us within a year of diagnosis responded almost 100%, while those who came between 1 to 5 years responded by about 95%. And those who came after 5 years of diagnosis responded to the treatment in 90% of cases. So look at the evidence, and it is growing. There are more papers. These are the clinical studies, about 9 studies. The first from India, second from China, third from Italy, fourth from US, fifth from US, sixth from India, seventh from Vietnam, eighth from Iran, and ninth from US. So a whole lot of work happening all over the world. And these are the publications from NeuroGen, about 16 publications. Overall, if you see, there is no major contraindication when you combine cell therapy with most of the other treatments. Only sometimes we say for the biomedical treatment, the supplements, to just give a gap after the treatment and then continue it. Oxygen therapy can be given immediately. Let's look at a few examples of how this treatment works. I'm sorry, I think I missed the PET scan. So the PET scan tells us we used it not only for understanding the severity of the brain affectation, but also to see how well the child is doing in terms of brain functioning. So if you see the PET scan here before the treatment, you can see a lot of blue areas here, right? All these blue areas indicate low functioning brain. After 6 months, you can see that the blue has become green. You can see the blue has become green. So the brain functioning has improved. That means that now the brain has the ability to take in information, and now you do training therapy, very important to continue the networking. Parents feel that we have done stem cell and that's the end of it. No, I would again like to emphasize that it is a combination. That's why we call it neuroregenerative rehabilitation therapy. You must, along with cell therapy, do good training, networking, and now we add on the integrative therapies to it. You can see here the blue areas now becoming green. This is a child we treated in June 2012, and this is 14. So over a period of 2 years, we saw that the brain functioning continued to improve. So whatever improvement is there, it doesn't reverse. Many parents ask me whether the whatever improvements they get, will it go back? No, if the brain functioning has improved, even if clinically sometimes you may see the child is behaving again, the stimming has improved or sensory, but it will go. What is important is that whatever the child has learned, comprehension should continue to improve. The outcome or the should not be decided by the sensory issues or behavioral issues. You must understand, as the child grows, behavioral issues are going to keep on coming, and they will change based on the age of the child. Now, this is a child whom we treated all in 2015 the first time. So it is almost 5 plus 3, 8 years back. Okay, now the child is about 19 years old. He came to us when he was 11 years. CARS 1 score was 26.5, which was like a moderate autism. He had fleeting eye contact, he had low self-awareness, no response to name, sensory issues, he had toe walking, eye cornering, he had self-talking, he had a lot of aggressive behavior, screaming and kicking, a lot of temper tantrums, he had very limited and fluent vocabulary, less fluency in vocabulary, very hyperactive and poor command following. After the treatment, in 5 months, he went from reading level of 3rd grade, 4th month, to a reading level of 7th grade, 1st month. So in 5 years, his reading level increased by 4 years. That's amazing, isn't it? His eye contact improved, his temper tantrums reduced, he started exploring new foods, his sensory issues became less. Earlier, he would wear only half hands clothes, or he would wear only crocs. Now he used to wear full sleeves and full pants, wear proper sneakers. His judgment, personal judgment improved. He could rectify his mistake. His cognition, memory improved. His attention improved significantly. Command following improved. He could shop food for himself. Problem solving. He saved his own life when there was a leakage in the kitchen. So his logical understanding, rationalization improved. Social play with other kids improved. It was better in emotional expression. He could ride a cycle. All this in 5 months. Independent in daily activities. His brain scan, you can see the blue parts becoming green. And this is the his result or report card, where he got A in most of the subjects. And he also participated in COR, and he also learned new languages like Spanish. And he got a GPA of 3.833 and made it to the honor roll 2017-18. So this child got 3 treatments, and now he's 19 years old, and let us see where he is now. He's now no autism, and this is him, 19-year-old. Now he's graduated from school and applied for colleges, and he did a tour to Ireland and all with his friends, backpacking, and like a regular teenage young man. His summer trip called to Ireland, England, France, summer job, computer camp in Cincinnati, completed Python tutoring class, now preparing for college season applications. Isn't that amazing? This is a child who came from South Africa to us earlier. When he came, he was say about 4 years old, and then 5 years old, and he was totally non-verbal, running around from here and there. Sitting tolerance improved in about 6 months to a year. His task became more independent. Earlier, he had to be made to do things, and then he would sit and he would do the task. You can see the differences is in about a year. Focus better, completing tasks better. Earlier, he would run away, try to run away. His father is trying to make him sit, but he's running away. Problem solving improved. So this was the first year. So we believe that the impact of this treatment remains longer, and let's look at the impact. So he came to us first in 2017, then 18, and 2020, the mother sends me This video.
Once upon a time, Pete the cat was walking down the street and his brain knew white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes. I love my white shoes. I love my white shoes. Oh no. Pete stepped in a large pile.
Okay, this is a 3-minute video, and with all the voice modulation, now Zach is actually making up his own story, and the story is an interesting one. If you any one of you want, just ping us, and I will send you the video. It's an amazing video. So the impact of the cell therapy, I believe, remains for 3-4 years, and you continue to see the development. So the foundation has been made, and you need to continue to work on your child. You will see long-term impact. This is a 13-year-old child. He was practically locked inside his home for 13 years, did not even attend therapy school. After the treatment, his sitting tolerance became better, his eye contact became better, motor activities improved, following commands improved, he became more manageable, he started riding a bike, he started swimming, he makes his own bed. So yes, he's not completely out of the spectrum, but he's much better than what he was for 13 years. So that's Victor from Kenya. So I think Mercy triplets, everybody knows about this story. So there are endless numbers of stories of children that I can share, and it's a experience of about 14-15 years now. Moving on to cerebral palsy, a little bit about cerebral palsy. I'm not sure how many parents here are interested, but cerebral palsy is an extension of autism in a sense that more severe brain injury because of very obvious lack of oxygen or infection during pregnancy, and depending on which part of the brain is affected, there could be not only a cognitive affectation but also physical affectation, and it could be tightness, spastic, it could be dyskinetic or ataxic, and you can see the brain damage is much more. The black parts are unsalvageable. We cannot improve the black part because these are dead tissue, but the light blue areas is what will be salvaged and can be improved. Treatment generally for cerebral palsy is rehab, surgery if there is deformity, or orthotics, medication for tightness and spasticity and dystonia, and for epilepsy, rehabilitation, and Botox injection. We again find about 90% of the children that we treat improve. They do good rehabilitation after the treatment. This is unpublished data where we find that first of all, if you look from top to down, first is the understanding, cognition improves, then the oromotor improves, eye contact improves, neck holding, sitting, standing, and hand function, tightness reduces, walking. Improvement in all the scores, GMFM, GMFCS, and FIM. Brain functioning improves in PET scan. And this is one of our studies. These are all our publications. Just an example of a child who came from Kenya, was severely quadriplegic cerebral palsy on the wheelchair. And in the first 6 months, he improved in his sitting, standing tolerance, hand function, ability to wear his own clothes. Where he was cognitively good, he was going to a regular school, so this helped him in better use of hand function, better independence around the house, ability to carry his own bag. A child who was completely wheelchair bound is now walking without support. So this is what cell therapy with good rehabilitation could do. Again, a lot of examples of cerebral palsy. Now I'm going to go to a little bit about intellectual disability. Again, brain functioning here is affected, and about 85% children do show improvement. This is the first ever publication where published by NeuroGen, first in the world, which talks about the role of autologous bone marrow derived mononuclear cell transplantation in intellectual disability. Again, you can see brain functioning affected before the treatment and 6 months later improved. You can see the brain is like you can see moth-eaten or a Rajitan brain, and now you can see a lot of functioning in this area. These all are publications. Again, a lot of examples, but I want to go to be, so complications wise, there are no major complications, no neurological deterioration that we see, but we do see in 3% of patients who already have seizures or epilepsy, whose EEG is abnormal, that there could be a transient stimulation of seizures in 3 to 6% of these children, and we try and prevent it by giving good anti-epileptic cover. So spinal headache after the procedure in about 10% of the patients. Again, prevention by good hydration, sometimes nausea, vomiting, pain at the local for a few days. The next part of my talk is about integrative therapies. This is what more can we do? So in this particular question, the answer is we can add integrative therapy, we can add oxygen therapy to enhance the result of the rehabilitation and cell therapy. So what are integrative therapy? What integrative therapies can be done in children? So let us look at this. There are a lot of things, micronutrient, gut cleansing is more for adults. In children, hyperbaric oxygen. So this is a hyperbaric oxygen chamber. This is known as a monoplace chamber where only one child at a time can enter, possibly along with the parent. So what does hyperbaric oxygen do? It increases oxygenation of the tissues throughout the body, right from the hair to the toe. Floods the body with 100% oxygen. The oxygen is administered at increasing pressure, more than 1 atmospheric pressure. And this oxygen not only goes into the red blood cells, it also goes into the plasma. So sometimes the red blood cells cannot enter very, very small capillary. There is only plasma or the fluid medium enters, and this oxygen diffuses into the plasma and helps goes into the plasma, into the different small parts. It increases the count of the stem cells manifold by stimulating the stem cells. So you can see here the upper part is the regular oxygen pressure. You can see the red blood cells carrying the oxygen. This this is oxygen. But here you can see at hyperbaric pressure, at increased oxygen pressure, you can see the oxygen is not only in the cells but diffused into the plasma as well. This is how you can see the child is lying. Children love it. They watch cartoons, that is the cartoon time. And hyperbaric has been used in a lot in anti-aging. It increases, prevents the cell from dying, so preventing the cell death. In exercise related injuries, muscle injuries, sports, a lot of time it has been used in head injuries, very severe head injuries, and muscle pains, fibromyalgias. Low pressure oxygen helps. In autism, also in Thailand, it has been tried. Hyperbaric oxygen alone may also help in coordination, improvement, language development, cross motor development, self-help skills. So just imagine that when you combine it with cell therapy and rehabilitation, the outcome together would be much better. It causes, what does it do? The hyperbaric oxygen causes stem cell mobilization and endothelial progenitor release. It has been shown to enhance the engraftment and the tissue repair effects of cell therapies. It also helps to improve the homing process, helping the cells to reach where they are supposed to reach. Better, it creates better microenvironment after the bone marrow transplantation, and it helps increase the cell number and give better therapeutic potential. Rapid mobilization of stem cells in human and even in diabetic mice has been seen to help in wound healing by improving cell therapy outcome. So it helps improve the metabolic activity of the brain in both children and adults. We can use it, and multiple sessions can be used. So you can see here, this is the monoplace. There are multiplace chambers as well. In multiplace chamber is like a room in which there would be different people. There will be people sitting and a mask or a shield kind of a thing. So oxygen will come only there. Outside it will be normal pressure. So increased pressure will be here only. In this monoplace, there is increased pressure throughout. So a lot of oxygen is used. But then claustrophobia is less for the child because here along with the child, the parent can also do it. So both monoplace and multiplace have their own, pros and cons. We find it easier to manage children in monoplace. They are lying comfortably, lights are off, we can go to sleep or watch a television, or so about 45 minutes to 1 hour is the general cycle rate. So like 1 per day for at least 10 days, if possible 20 days. The maximum at one stretch should be 40. Generally not recommended to do more than 40 sessions at one stretch. The second part is the ozone therapy. Now, ozone is an active form of oxygen. We know that oxygen is O2. Ozone is you can see here the ozonator. When oxygen is passed through the ozonator, it comes out as a gas, which is O3, which is highly labile. So it's like, it's like a volatile oxygen. And when it is administered into the body via different ways, it can go either through the oil medium and be inhaled as a steam, or it can go through our skin, percolate through the skin in a sauna, or in children we give it like you do an enema. It's called a rectal ozone, or we can give it through the ear using a stethoscope. So here the oxygen goes, when you do it through the ear, it goes directly to the brain. When you do it through the rectum, it goes through the gut, helps to cleanse the gut, as well as it gets absorbed into the gut as well and goes into the bloodstream. It's an excellent antioxidant, anti-inflammatory, anticoagulant. It thins the blood and thereby improves the blood flow, and it kills virus, bacteria, fungus, parasites. I know most parents are worried about candidal infection in the gut, this and that. And so this is a very selective germicide. It will kill only the bad bacteria or the bad virus. It's a very natural germicide. Improves oxygenation, regulates oxidative stress, regulation of prostaglandins, immunomodulator, excellent germicidal, metabolic regulator. So it's a very good immunity booster as well. Improves gut, improves oxygenation, stimulates stem cells. It can be given, as I said, rectal insufflation, ear insufflation, can be through oil. It can be given as intravenous saline. It can be given as a sauna, and for local application, we can do a bagging for the hair, for the wound. It can be given into the joints. So there are different ways that ozone can be administered based on what the indication is. This is the ear insufflation. You can see that through the stethoscope it is being given. This is the boto, we call it, through the oil. This is good for sinuses and lung issues. This is the sauna. This is done for COVID. So COVID, we did intravenous saline. We are not showing rectal ozone, of course. Difficult to show that. So this is a medical ozone. This is not a toxic ozone in the environment. So that's the disclaimer. But for those who have seizures, we do not give ear insufflation. It cannot be given when there is active bleeding from anywhere. So this is about the medical oxygen, and you can see that it is going through the one, and what is coming out is the ozone, and here you can see that's the ear. The third combination of integrative therapies is the deep tissue mobilization. Children initially resist it, but then later love it because it calms them. It helps at different point, pressures at different points, helps to relax, improve the blood flow as well. It relieves muscle tension, helps us also to improve, feel very relaxed, improves the blood flow, and it stimulates our aerobic performance by more than 10%. So this is NeuroGen Brain and Spine Institute, as all of you know. Hopefully we should all meet someday. Looking forward to welcoming you here. More than 12,500 patients from 75 different countries have been treated here. Our focus here is only neurological conditions, where we have an in-house stay facility along with that. So it's next to a very beautiful lake, and it's a much more organized part of Mumbai. Mumbai, most of you all know what, who, and where Mumbai is. Mumbai is the most happening city, just like Manhattan or New York. But Navi Mumbai is like the suburbs of Mumbai. This is the operation theater. We have 2 operation theaters connected to a stem cell lab. The stem cell lab is just adjacent to the theater, and nothing goes out of this complex. So the bone marrow goes into this lab through a window, gets processed and goes back through the window back to the OT. So nothing goes out. So infection rate is 0. Comprehensive rehabilitation under one roof, physiotherapy, occupational therapy. This is adult as well as children, occupational therapy. Autism Child Development Center. Children love to play here, don't want to go back to their rooms. Spinal cord injury walking track. This is for adult patients. Sensory integration for children with autism and CP. Activities of daily living training. Speech therapy, art therapy, special education. And along with that, our sister concern, the KLS Wellness Institute, where focuses on rehabilitation and the integrated therapies like oxygen, ozone, deep tissue mobilization. For adults, the hydrocolon therapy. So a lot of parents who have come with the children, for them, it's a big reprieve. They get to relax as well. We pamper them with massages, and those who want also do this gut cleansing and infrared sauna, cryotherapy, vitamin. So, you can help rejuvenate yourself as well, because a parent has to take care of themselves first. If you are not well, then how are you going to take care of your child, right? So this is a KS Wellness. So all our books, we've written books not only for professionals, but also for parents. Please do see, they are all available online, free of cost. This is our core team, which has been together for the last 15-20 years. Now, Dr. Alok Sharma, the director, the vision, the man behind the whole vision of integrating different therapies and the teamwork. Me, myself, one of the deputy directors, Dr. Jacob is 80 plus, but 18 at heart. I always tell him, one of the most renowned and senior physiotherapists in health and neuro rehab. Dr. Prerna Bade, the expert in the lab who makes your child cells. She's a neuropathologist. And Dr. Himangi Sane, an inspiration to all of us. She is a internal medicine, MD medicine from New York Medical College, herself a patient of amyotrophic lateral sclerosis of motor neuron and a stem cell recipient and the head of research. So we are all the deputy directors. We work together to guide the whole team. We are ISO and GLP GMP certified, and received many awards, national as well as international, for the professional work that we are doing. Our focus is always in evolving what works best for our patients, for our children, whatever works best. We are ready to innovate and get them for you. Plus, of course, the focus is on the parents, the therapy, and getting together a holistic approach to help you be able to take care of your child once you go back as well. In order to reach us, you can reach us at neurogenbsi.com, and you can call on this number as well. You'll get a coordinator who will help you. We have a 2-week treatment and a 1-week treatment. Sunday you arrive, we do all the blood workup and brain scan. Sunday, Monday, we discuss with you all the results. Tuesday is a day of cell therapy, just 1 day. Wednesday onwards, the rehabilitation starts. Those who are staying for 2 weeks, from Wednesday, we also start the integrated therapy, that is oxygen therapy and all. And Saturday is the day of discharge. So why NeuroGen? What's different? We have the largest number of scientific publications in the world. It shows 99, but it's 106 now. We have written book chapters in international books. We are the only cell therapy center in the world that treats only neurological conditions. We use safe treatments like autologous cells and inject intrathecally, which reaches the brain. We have a comprehensive combination of cell therapy and rehabilitation along with integrated therapies. We have treated over 12,000 patients from 75 different countries, and the team is led by very senior and experienced professionals. We constantly research, we keep on looking at what more can be done, and we have all our work is approved by our institutional ethics committee. So to sum up, adult cell therapy is safe and it is effective for neurodevelopmental as well as other neurological conditions. And to believe that what has not occurred in the history will not occur at all is to argue disbelief in the dignity of man. Our father of nation of India, Mahatma Gandhi, he alone led the struggle for freedom, which was evasive for the last 200 years before he tried. but he did it. And we believe that freedom from neurological condition is possible. And to believe that it is not possible is to disbelieve in the dignity of man.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
That's what we are also attempting. That is our focus, and love to play this video at the end for two purposes. One, because it's a very inspirational talk. Obama was a very path-breaking president of the US, but also to let people know that 2008, when he became the president of the United States, he actually, in one of his very, in his presidential talk, did lift the ban on federal funding for embryonic stem cell research. So number one, the ban was on embryonic stem cells, not on adult stem cells, and that was lifted in 2008. So that is just to bring to your focus attention that it was about embryonic, but adult stem cells were never banned ever. So so this is our contact details. Feel free to reach, and I'll be now taking the questions which I can see on the question answer. So I'm going to start from, everybody's anonymous. Nobody wants to tell their name. Huh? Okay. So how many shots needed for stem cell therapy? Can we break down the overall cost somehow? For every child, it would be different. We base the possible requirement basis their initial assessment when they come to us, clinical as well as the brain scan, give us an idea how severe the problem is. A child may require 2 sessions within a year or may require 3 to 4, so rarely a 4. So the cost, you can reach our coordinator and they will give you the cost breakup. Is there any side effect with the stem cell for 5-year kids? I have answered about the side effect because these are your own cells. They do not have any long-term side effect immediately after the treatment. Few children do have a headache, nausea, vomiting, known as spinal headache. Those who have a history of seizures may have seizures, about 3 to 6% chance of triggering or stimulating seizures transiently with medications can be controlled. Is PET-CT scan a standard name or does it have other name as well, like EEG or any other name? PET-CT scan is a standard name. It is known as positron emission tomography scan. It can be done for the whole body or it can be done for the brain. What we need is a neuropet. PET-CT scan of the brain is what we require. Does SCT improve gut health and address any gut issues related to ASD? Eventually, yes. The gut-brain cycle is like a chicken and egg. What came first? So there is a lot of discussion whether, because the brain function is affected, does that lead to the gut becoming slower, known as the gut peristalsis? Or is it that the gut is slow and thereby the absorption is affected and thereby the brain functioning is affected? So it's like a chicken and egg thing. Even initially, we'll have to work on the gut with local, like that's why we have now introduced ozone, which works very well with the gut. So once the current gut issue is taken care of, as the brain functioning improves, it will help the gut movement to improve. So we have seen many children, their constipation becomes better, their eating improves after the treatment. But of course, it is a process. It will take some time. Hmm. The next question is, we are planning to do SET in October. Please let me know process and pricing and accommodation details. So one of our coordinators will reach you. They will discuss all those logistics with you. What is your thinking about FMT and MOT for better outcome? Magnet therapy is okay. We have not had an experience with magnetic therapy. To be very frank, there are so many treatment options for autism when done individually, but we are looking at what can we put together. So with cell therapy, we find oxygen therapy works because it synergizes, and cell therapy and rehabilitation works because there is synergistic. We did look at the option of QEEG, but we didn't find it to work very well with the cell therapy because the principle is different. The principle or mechanism of action is different. FMT works very locally on the gut, is what we have heard, but it's more for adults. I'm not sure how well it works in children. Very difficult to think to put shit of one child into another child. Very frank. We are going to do a little bit more research, but may work. I'm not going to completely refute that, but in combo we have to look at what works in combo. Like for example, when we are serving food, okay, we can't serve burger with curry, right? So we can't give burger with the chicken curry. So it has to be the right combination. So on its own, FMT may have, but is it long lasting? Is the effect long lasting? That's what we need to see. What is a good amount of HPOT to see a good amount of improvement? See, on its own, it is known that about 40 sessions of HPOT on its own is required to see a good outcome, at least 40 sessions. With the cell therapy, we find when you do cell therapy with rehabilitation, and 10 to maximum 20 session is good enough because here you are working together. So 10 session of HPOT, 10 session of ozone, cell therapy and rehabilitation together should give you a good outcome. But on its own, 40 sessions will be required. What is different between ear ozone and anal ozone? Ear ozone, oxygen, the ozone is given through the ear. Anal ozone, when it is given like an enema through the rectum. So when you give it through the ear, it tends to go to the brain directly. When you give it through the rectum, here the oxygen will help the gut, as well as it will get absorbed and go systemically. So the roots will define where is the ozone going. Can any of your HBOT ozone SCT help with reducing seizure activity? No. In fact, we find that cell therapy as well as HBOT may be triggers for seizure activity. So, our prima facie, no. In fact, only for seizures we don't do. We do a good anti-epileptic cover. Those who have a history of seizures recently, we do not do HBOT. We can do cell therapy, but HBOT we do not do because during the HBOT, if the child has seizures in the machine, then taking the child out would take at least 10 minutes because the pressure has to come to normal, and then only we can open the door. We can't open the door of a pressurized chamber. So for those who have active seizures, in fact, HBOT is not recommended. What is the way you make sure no mistakes are made while handling the cells, like getting them mixed up among patients? So every child who comes into the OT has a tag in his hand. Okay, and when he's taken on the table, we check the tag and check it's the same child. The bone marrow is put in tubes, which is labeled with the child's name. This bone marrow goes into the laboratory with the label, that is processed with the label, and when it comes back to again, there is a label. And we check the label, check the child's name, ensure that it is the same child, and then inject. So this is a whole cycle process with labels everywhere. Getting hold of the coordinator, Larissa, of patient America, is a struggle. She does not respond back at all, or if she does, then not in a timely manner. I'm really sorry, apologize on her behalf. I will ensure that she takes care. If you could, send me your email as to who you are, I would ensure that it is you are taken care of. I apologize if she has not responded. Usually she is very prompt in responding. How many maximum shots can be done for a child with autism? I hear patient of yours getting as many as 6 to 8. What's too many to be dangerous? 6 to 8 shots generally seen for children with muscular dystrophy. Autism maximum I remember is about 5, very rarely 6. Because these are the child's own bone marrow, there is, so far we have not seen any danger in repeated treatments. Muscular dystrophy, in fact, some people have got even 10, 11, 12 shots. Because muscular dystrophy is a degenerative condition, and doing repeated treatment keeps the child at least stable, or the slowing down, the deterioration is slowed down. So as such, it is not dangerous because there are no long-term side effects. There is no tumorigenicity. That's why 14 years we have not found any tumor formation. Is there a therapy for 3-year-old? How often we have to come back to clinic? We don't live in India. Yes, we have treated a child as young as 15 months or 18 months also. A 3-year-old child can also be treated. First 2 treatments within a year is what I recommend if required, based on the severity, and then we can decide when you need to come. In the first PET scan, can you tell us how much deficit there is and how many injections? Yes, Mr. Surya, it is possible to give you a broad outline as to how much the deficit is and how many treatments may be required. No, I think there is, this will require for me to really give you a 1-hour talk on is stem cell therapy for autism banned by IMA. No, there is no IMA. IMA is Indian Medical Association. IMA does not talk about therapies. It's about medical education, number 1. What you are saying is National Medical Commission had given a recommendation. It is not a guideline. It is not a legally binding document. It is a recommendation based on their literature review that stem cell therapy does not work for autism. There is not enough evidence. However, they have taken into consideration only 8 studies. There are 34 studies which are available. They have not taken into consideration all those studies, including our own study, number 1. Number 2, as I said, it's a recommendation for stem cell therapy. Stem cell therapy has 2 parts. Is a stem cell derived products and cell therapy that we do. They are talking about multiplied cells or cells taken from outside. What we are doing is cell therapy. Doesn't strictly come under stem cell therapy because we are taking the bone marrow from the patient, separating the cells and injecting into the spinal fluid. For lay person to understand, many times it is referred to as stem cell, but no. So this is just a recommendation. Government of India, in fact, has made a list of practices and procedures which does mention onto a bone marrow derived cell therapy as a clinical option for autism. Do you perform multiple therapies along with stem like oxygen therapy you showed earlier? Yes, we do a combination. We do cell therapy, rehabilitation, and oxygen therapy together. What is duration of treatment in NeuroGen? We have 2 treatment durations, 1 week, that is 7 days, and 2 weeks, that is 14 days. Kamalas, does the brain function differ when in sleep or awake, which reflects in the PET scan? My son is non-verbal, highly active, and is 9 years old. For all children with autism, we have to give sedation. So the brain functioning that will be seen is a sedated brain. So a brain which is active may give some of the areas to be more active, but the scan cannot be done because the child will be awake. In an awake child, scan is not possible. We have been giving multivitamin supplement to my 4-year-old kid. Can we continue giving supplements as we have on 4th June? You can continue to give the supplements, just stop a week before. We have just seen ones that in some children who are taking omega and vitamin omega actually, that sometimes the platelets are a bit low. So just stop a week before and you can restart after a month. Prakash says, thank you for your session, Dr. Nandini. Thank you, Prakash, for acknowledging, and happy to do so. Any restrictions? Any restriction on diet activities after SCT? No restriction of diet or for activities. Absolutely. Next day the child starts running around, jumping around. No activity restriction. Diet wise, for autism, it is recommended that try and avoid sugars, hyperactivity increases. Otherwise, for cell therapy, there is no restriction. My question is for combination stem cell with FMT and MORT. Neurofeedback, this is another clinic that claims that there's been reported of huge gains, but there's a new clinic versus NeuroGen is well established. So what did you report? No, I understand that. I understand different people have different experiences, and I'm talking by our experience. So we have really not experienced FMT or MORT or neurofeedback. We have tried for some neurofeedback. Again, it is needed to be done for a long time. It gives effect very slowly. So combining it with cell therapy logistically became very difficult. So the way that they work are different mechanisms. So we have not found a cohesiveness. Once we find enough evidence that it sort of synergizes with the current treatment that we are doing, then we may do it. But at this point, we are not convinced ourselves. My child had cell therapy in February, but no improvement or regression seen. Is there anything we need to be aware of for the next cell? PET scan shown severe. So February in 2023. So this March, April. It's just 2.5 months. At least 3 to 6 months to see the changes. Continue the training. Very important to do therapy. Therapy is very important. The more you stimulate the child, better the child improves. So give 3 to 6 months. Wait for 3 to 6 months, you will see improvement. Will you give rectal ear ozone therapy in 14 days program? Yes. Srinivasan, we will be giving rectal and ear ozone in 14 days program. Only thing is that we do not give ear ozone if there is a history of seizure, because that increases the possibility of stimulating seizure. Then we give only rectal. Would stem cell be beneficial for 16-year-old who is suffering from CP? We will need to evaluate the patient. If you can get in touch with us, depending on what is the condition of the child. Because in a 16-year-old, if it's a very severe CP with no neck holding, then there is a possibility the hip may also have dislocated. There may be deformities. So the outcome of the treatment also depends on when was the injury. So in a 16-year-old child, the injury is at birth. So 16 years old injury plus the other comorbids like seizures and severe deformities. So we will need to evaluate each case on its own. What you could do is we will get in touch with you, take all the information and give you our readout as to what best can we do for this child. So we can, theoretically, yes, treat a 16-year-old child, but we will need to evaluate and tell you what is the prognosis, what can we expect in this child. How long we have to stay in Mumbai at a time for therapy? Minimum of 1 week or 2, or up to 2 weeks. Can we have weekly once for 40 weeks post stem cell? You can have, but the effect is not going to be so good. Once a week for 40 weeks is a long time. And effect is generally cumulative when you go give. So at least give 10 or 20 sessions back to back, and then you can make it like twice or thrice a week. Then maybe it will be effective, but 1 per week is not going to be effective. We live in UK, and this is like no by the doctors. If there are any issues after SCT, maybe minor health issues, are you still available remotely to discuss? Yes. We are always just a phone call away. We will always be there with you. Whatever we can, solve and give you on the phone, we will. Having said that, we suggest that if there is any regular cough, cold, fever, other issues, which irrespective of the cell therapy, you can always go to your own doctors, right? It is not always necessary that any ailment of the child be connected to cell therapy always. For example, if I am a human body, then, I will have a fever or a cough, cold or anything. So you will need treatment, and the local doctors are best placed for that. So we are always there for you whenever you need us. We will be available online. But for small ailments, do also connect to your, do inform us and do connect to your doctors as well. What anesthesia used for the whole process? It is intravenous sedation with a little bit top-up of general anesthesia. So intravenous, we do not use inhalation anesthesia. Do you use any antibiotic during treatment or after treatment? 2 days of antibiotic perioperatively. So on the day of the treatment, intravenous antibiotic, the next day 2 doses. So 2 doses of antibiotic, 3 doses of antibiotic. What is percentage of recovery different for different age groups? Yes. It is different because you can see that the brain functioning, if you remember the slide which I showed, that brain functioning continues to go down with age. So as the age increases, the brain's capacity to repair, regenerate, or plasticity of the brain is lesser. Plus, the child also become very stubborn, no, after a certain time. So younger age, the brain is very tender, is ready to learn new things. So younger the age, that's why better. It's like anybody. Like if you have a cough, cold, we treat it today, it will become all right. But if you treat it after 15 days, it will take longer to get treated. So earlier you treat better because the brain is still learning new things, and the later you do, the brain becomes very stubborn. You treat a 13, 14-year-old child, he already has his hormones, creating a havoc, and then you want the brain to improve and you're stimulating the brain. It's going to be like a double jeopardy. So yes, that's why the effect. Plus the parents are also like, very focused in the first 5 to 10 years. They're really putting all their efforts. The outcome is better when the effort from the parents, effort from the cell therapy, effort from the oxygen therapy is all together earlier. James says he had ozone, HBT as well. Very good. Please get in touch with, I will ask the therapist to also guide you. If he's in India and he's getting therapy every day, he will improve. Just give him 3 months to 6 months. What do you think if a child gets cells from you and in the future uses donor cells from another clinic? Is that advisable? It's your personal choice. There should not be any problem. Just be careful what cells they are using. So they should not have any issues. Thank you so much for this session. We found it very helpful. Thank you, Sarika, for patiently listening and asking questions. It's always good to have this interaction. I love when parents come out with questions, and happy to answer as many questions as doubts you have. Very informative. We'll see you soon. I'm sure your name is coming as anonymous attendee, so I don't know who you are, but thank you for attending the session. Pricing and accommodation, it is different for US one, Indian one. So our coordinator will connect with you and give you the pricing. This is more for awareness. This is academic session, so I do not talk about cost here, but you will be, somebody will be getting in touch with you and connecting with you and giving you the cost. Does GFCF diet help in reducing hyperactivity? Yes, I think GFCF diet does help reducing hyperactivity. If you can do that for your child, that would be good. It works in 50% of the children. When is the second shot? After 6 months, between 6 months to a year. James, when can you see changes? After 6 months again. So wait for 6 months to see the changes in the pet as well. Can extended rehab be arranged from you? Like you want to live in there for 6 months to 1 year? Yes, there are many parents who live outside. They take up rental accommodations and come to us for therapy on OPD basis. That can be done. How far the special day like gluten-free, casein-free helpful, and how long we need to continue the diet? So diet, see, let me tell you about gluten-free and casein-free diet. It's not just for autism, it's for you and me also. I tell everybody, I tried gluten-free, casein-free diet for 2 months, and it really helped me. So gluten and casein tends to somewhat stimulate a lot of, indigestion. And when I stopped that and I went on jawar and rice, and I started drinking tea without milk, avoided milk completely, I found that the gas production in my gut is much reduced. I have a very gassy constitution. So that really helped me. So I think that's what is happening in children with autism as well. They are unable to tell, and because of gas production, they are very hyper, they are unable to sleep, they are constipated, absorption of nutrients becomes affected. So that's where the gluten-free, casein-free diet helps. This is my suggestion and advice. Start with reducing one of them. First thing is stop, refined sugar and very, high sweets, and sodas and aerated drinks. That is an absolute no, number one. Number two, as much as possible, I know it's difficult, children are picky eaters, try and introduce vegetables slowly and steadily. Make it interesting, make the vegetables interesting. Number three, if the child is only on milk and loves only milk, you can't really stop milk at one immediately, because he or she will stop eating. So do it gradually, maybe liquefy the milk and see whether that you can make it more liquid and slowly wean off the milk. Gluten, if you can convert, avoid wheat and then try bajra, jawar or rice, try it, but do it stepwise. Do not give gluten-free, casein-free diet at the cost of general food and nutrition, because your child is a picky eater, right? So do it gradually. Irrespective of the cell therapy, irrespective of the autism, gluten-free, casein-free, dairy-free does help reduce a lot of your problems. Can you send recording? Yes, you will be sent a video recording of this session. Thank you for your time and effort. Thank you for your patient hearing. Would you be able to do outpatient appointment to discuss before starting the treatment? Yes, you can come on outpatient basis, or you can, our doctors will connect with you online as well. We'll do a virtual consultation as well. We find very difficult even for blood test injection with my child. How can he be sedated? I know, Kamala, it's not easy. Initially for blood, we do have to hold the child and take the blood. For the sedation, yes, we have to hold, we have to insert a IV cannula, and then immediately sedation is given. The anesthetists here are quite, experienced in this. If you help us a little bit, it is possible to do it. Srinivasan, thank you for a wonderful session. We'll meet soon. We'll see you soon, Srinivasan. Have a good day. We are in US. How many days required to be in Mumbai? As I said, 1 week or 2 weeks based on the therapy sessions that you take. What are chances of non-verbal to become verbal after SCT? How many shots? Depends on the age of the child, how severe the problem is. It may take 2 to 3 shots based on the child. In some children, they've started speaking in 15 days, and some it has taken 2 years. So every child is different. Any test to be done before SCT? Can it be done in Mumbai itself, and how long? For local patients, those who are in India, we do give them a list of tests and they do it locally. For those who are coming from outside, because our prescription may not be valid for you there, when you come here, we do the blood test. That is only for a day. The second day is a brain scan. Generally, we need the child's hemoglobin to be good. The child should not have any cough, cold, fever, preferably during that time. They should not have any chickenpox, measles in the last 2 to 3 months. Avoid vaccines in the last 4 to 6 weeks before the treatment. This session was very helpful. Thank you. Is this Zoom session recorded for sharing with family? Yes, Srideva, yes, you will get the recorded Zoom session. Does stem cell be taken from sibling for SCT? Does it make any difference on SCT outcome? We have never used sibling. These are donor cells. So donor cells is like a transplantation, and a transplantation would like a bone marrow transplant requires a whole lot of you need to. It's like a organ transplantation becomes very complicated. So no, we do not use sibling bone marrow. My son has abnormal EEG. Doctor said he's having silent seizures. If you go for SCT, does he need to take seizure medicine? Right now, he's not taking. Yes, abnormal EEG must take seizure medicine after the cell therapy, because more likely that the seizure may get stimulated. So for a minimum of 6 months, the medication will need to be taken. Will there be a dedicated to whom perform cell therapy? Yes, the team. It's a dedicated team headed by Dr. Alok Sharma. I am one of the team members, and then we have another surgeon, so 3 of us with 3 anesthetists, and there is a neuropathologist for the cell separation. I asked for speech question. My child is almost a teenager, not able to use device or words. So it will now, if your child is a teenager, I think it is not just the speech. We'll have to look at the comprehension, ability to take care of himself, activity of daily living, because speech is not the only issue in a child with autism, right? Like for those who have hearing deficit, they cannot speak. That speech is the only issue. But here it's a lot of processing. So we need to first evaluate how severe the child's condition is. A teenager parents want the child to speak, but if he doesn't have comprehension, he doesn't understand what he is doing, what is the point of a speech? It will become like a uncoherent speech without any meaning. Would you give IV antibiotic to child after SCT? During SCT, on the day of the procedure, yes, we give IV antibiotic. If you think donor cells are like a transplant, there's a chance of getting the cells rejected in the body. Yes, exactly. Can we get the coordinator contact details? We need to start the process facility. Sure. You can reach us at 9920-200-400. Just drop a WhatsApp message. The coordinator will get in touch with you. For how long do the cells stay active in the body? The cells that you play. So we are injecting the cells into the spinal fluid. They have a finite multiplication potential and they integrate into the brain. So 3 to 6 months is when the cells will become adult and integrate into the brain and remain alive there. So they will not multiply indefinitely lifelong. Okay, so but they will integrate into the brain and remain alive. If we only do cell therapy without adjunct treatment for improvement, that's okay. Before 2 to 3 years back, we were not doing oxygen therapy. We were doing only cell therapy with rehabilitation. We were getting good results. We are just looking at what can we do to improve or enhance the treatment effect. So you are most welcome to come only for 1 week, no issues. Kamala, will the child be sedated for the whole process from taking, during processing and injecting back? Yes. While taking, we do sedation with a short general anesthesia for that time, and the sedation prolongs for about a few hours so that the child is sleeping, but he will be with you during that time and the fluids will be going on. And once the cells are ready, we'll call back. Again, it's a 10-minute procedure. So 10 minutes of aspiration, 5 to 10 minutes of injection. In between, the child is sleeping and he's there with you and fluids are going on. If the child is on the spectrum, how are we sure that cells from the child work? Do you think they have an underlying problem in his own cells would increase their problems? So what we are using is the bone marrow cells. We are using the cells from the bone marrow which are producing good blood. So if we see that in the blood there is a problem, then we will not do the treatment. Like for example, if hemoglobin is very low, the platelets are very low, WBC counts very high, the liver function is affected or the kidney function is affected. That's why we do a whole list of tests. And so what these cells are doing are stimulating the brain cells. So in the per se, if you see that your child is growing fine, physically he is okay, have skin is all right, other organs are fine, heart is doing well, why do we feel that the bone marrow will not be okay? There are a few children who do have sickle cell anemia, thalassemia along with autism. Then in those cases, we cannot take the bone marrow. So you understand what the bone marrow is doing is producing good blood. If the blood counts, everything is fine, there is no problem. How long will the child be sedated? He will be sleeping or drowsy for maybe like 3 to 6 hours, but not like completely, knocked off. No, knocked off for like 10 minutes during the aspiration, 10 minutes during the injection, in between drowsy or sleeping. So the hospital number directly that you can reach is 9920-200-400. So before that, if you are not from India, +91. So 9920-200-400. That's the hospital number. And then it will be allotted to a coordinator. So different, depending on which country you are from, the coordinator will be assigned. How long is the appointment waiting time? If I book now, when will I be likely to get appointment? I'm from Kerala. I'm not very sure. I think we are booked till June. I think maybe July. We should be able to get. Adult autistic patients say ABA is not good. Now, non-verbal patients are saying that they don't want to return for repeat shot right after the first shot. I'm not sure I understand that. If verbal patients are refusing, then does that mean it is not comfortable? I didn't understand what you're saying. About ABA or about cell therapy? Achha, ABA in NeuroGen is not good. See, we have a comprehensive, we have occupational therapy, we have speech therapy, we have behavioral therapy. So it's not strictly ABA. It will be cognitive and behavioral therapy. It's a combination therapy. So I don't know if there is, I'm not sure what you are saying. I will need to understand. There would be a little pain. We do cover with painkiller, but it is not completely. Children will be not very happy with needles, right? So it is a needle in the hip bone and needle in the back. There would be for 2-3 days there will be a little discomfort. I heard that heavy metals or mold presence in child body might not be much helpful with SCT. Do you have any insight? The cell therapy where you inject the cells intravenously into the bloodstream can be impacted by the heavy metals in the blood. So those in Panama and Mexico, when they're giving intravenously, then what we are doing is we are taking from the bone marrow, injecting into the spinal fluid. So here, neither the mold in the gut nor the heavy metal in the blood will affect the outcome. No. We're planning in October. Please let me know the process, pricing, of accommodation. Yes. So, oh, I think I'm going back to the same. Any pain after SCT, any back pain, they can be for 2-3 days. And I said there could be a spinal headache, which remains for 3 to 4 days. In 10% of the patient, there can be a headache. When they sit up, they have a headache. When they lie down, they feel better. That's part of the procedure. So out of, suppose 100, 10 may have that. We try and hydrate the child to prevent it. If PET scan blood test will do the same day and stem cell we will do another day. So will you be giving sedation for both days? See, blood test on Sunday, scan on Monday, and procedure generally on Tuesday. So yes, for both for scan and for procedure, sedation will need to be given. Yes. We have done FMD recently. Do you think we can go for SCT or need any time gap? I don't see any problem with FMD and cell therapy. No, you can do the treatment immediately also. But if you want to see whether there is an effect of FMD, then I think 2 to 3 months you should give for that. We'll see whether there is a change in the gut metabolism and gut flora. So I think give 3 months gap after FMD. The whole procedure comes like this. You come on a Sunday. Sunday, there would be 2 things. There would be blood workup and there would be a clinical assessment. Monday morning will be the MRI and PET scan. These are 2 different scans at 2 different places, both needing sedation. And rest of the assessments is done on Monday. After the blood test on Sunday, you get an injection known as granulocyte colony stimulating factor, which stimulates the bone marrow. 1 on Sunday, 1 on Monday. So this is a pre-preparation for the treatment. Monday evening, we discuss all the results with you. Then Tuesday, we start the procedure. We make a schedule on Monday and we let you know either Monday night or Monday evening. Tuesday, first part is bone marrow aspiration. It's a 10-minute procedure where the sedation and anesthesia is given. Then the child is back in the room when he is sleeping. IV fluids are going on. Depending on the sample, it may take anywhere between 3 hours to 6 hours for the cell separation. Once the cells are ready, we call the child back to the operation theater. The injection is about 5 to 10 minutes. So that's all for the procedure. Day after that, the child, once he's awake, starts taking fluids. We suggest, if possible, to keep the child lying on the day of the procedure to prevent a spinal headache. A spinal headache may come anywhere between 24 to 72 hours after the treatment. That's why minimum of 4 days, we keep the child with us after the treatment. So Wednesday to Saturday is one observation for any pain or vomiting. Number 2, rehabilitation. So that's for a 1-week treatment. Those who opt for a 2-week treatment, along with rehabilitation, we start oxygen therapy, which goes on till the next Saturday. So this is how the whole process is. We have done will there be improvement child with autism after cell therapy? Yes, depending on the age of the child. About if less than 5 years, there is a 90 to 95% chance the child will show improvement in 3 to 6 months. Is there any proof that casein, lactose, gluten-free diet will help these children? There are many publications where they show that about 50% of the children do respond to a gluten-free, casein-free diet. Do we need to stop any medication? How many days before the SCT? So never stop an anti-epileptic medication or a thyroid medication. Multivitamins can be stopped for about a week before the treatment. Do you recommend any homeopathy or Ayurvedic investigations. Do you recommend any prerequisite test for a child if they are non-local to Mumbai, just to avoid being surprised once? Yes. Those who are local, those who are in India, we do send a list of investigations to you to be done before the treatment. And once we receive them and they are all right, then we post you for the treatment. Are we done? There are a lot of questions. And then, oh, there's 78th question coming in. I can't see that. Did anybody put any question? No, I put that. Yeah. What is the blood test you do reveal that stem cells are not good enough? If we see if it is a blood test showing that there is an infection, we would treat the infection and then do the treatment. If there are sometimes, unfortunately, sometimes when children come, we see there is a hand-foot-mouth disease or there is a viral eruption, then we have to actually postpone the treatment for a few weeks or month. So then they go back. If the blood test show anything grossly abnormal, then we will discuss with you what are the options. If hemoglobin is very low, below 10, then we don't do the treatment. We'll wait for the hemoglobin to rise. So depending on whether it is immediately treatable, one is that you have a problem, you can treat it within a week. We will do the treatment and then do the treatment, and we treat that particular problem and then do the cell therapy. But if we think that this is something which will need a long-term follow-up, we'll first suggest that you do that and come back. But these things happen very rarely. Yes, you can do the blood test where you are located. What we have found in UK, US generally is difficult to get blood tests. Then that's why we stopped giving the list to them. But if you think it can be, you can. But no, I don't think routinely blood tests are very easy to be done in UK, US. That's why I stopped giving the investigation list. We can give you the investigation list if you think it's possible for you to do it. Are the children NPO on Tuesday, Wednesday, Monday, and Tuesday? Nil by mouth on like Sunday nights from 12 o'clock onwards till the scans are over. Then again on Monday night till Tuesday till the scans are over. IV fluids go on. Why there were recent news on ban at NeuroGen? Can you give more details on the boost our confidence? I did give you that information. That I think I explained the whole NMC thing. Were you not there? So this is a whole. It is a conspiracy by a group of 400 rehabilitation centers and neuropediatricians and neurologists. They do not. They want to, of course, stop our work through vested interest, through certain people. They gave a illegal order to stop our work. We appealed to the Health Minister of Maharashtra, who reverted the order, and we are working. So this is a conspiracy that we knew that we are a threat to those people. It's a very long historical back and forth. So it's not only about NeuroGen. If it was about cell therapy, they should have stopped the other center also, right? It's more targeted towards Dr. Alok Sharma. What if as I said, we can send you the list of tests, and can you help with some meds to help children stay still after spinal? After the when we give the spinal, anyway, the sedation is there for a couple of hours. It has to sort of go away for some time, because the child needs to start taking oral feeds, right? And if the child sits up and has fluids and eats, it's all right. You can make the child lie down after he eats or something. We can give some oral medication to keep the child a bit, calm down and drowsy, but only after he eats, because we want the child to start oral feeds. It is important to hydrate. That's the most important thing. IV fluids are most important, and oral fluids are most important. My youngest son, age 3 years, 4 months, has autism. My oldest son, 5 years, look normal. Is there any test to be done to find out whether there is anything to worry about for your 5-year-old? No, if he's normal, don't bother. Why do you want to do anything? Please just let him be a child. Let him be naughty, let him play, let him go to school, don't do anything. 2 months back, there was an order to stop our work, which has been, we made appeal to the health minister, and that has been reversed, and we are working. Is MRI safe for a 5-year-old child, and what about anesthesia effect to the child? These are very, Vandana, these are very short-acting anesthesia and very safe. Do not have any problem. We have been doing this for 14 years. There are no post-anesthesia issues. Don't worry. Can we give Phenargan oral syrup? Yeah, for keeping the child drowsy. Yes, we give intravenous Phenargan during the sedation. We can give Phenargan. We can give melatonin. Yes. How many days before these tests to be done before SCT? Those who are local, they do about a week or 15 days before. When those who come from overseas, we do it on Sunday, a day before, 2 days before the treatment. Any more questions? Feel free to send an email to us. It's almost 8 p.m. here. I'm sure you all want to go back to your family. Oh, there's one more question. Sonal, what anesthesia formula you give an antibiotic? Describe the adult OT. I don't understand. We have done MRI in US for child. We need to do again. If you have done MRI within the last few years, we need not repeat the MRI. We'll just do the PET scan. Anesthesia is a for sedation with a little bit of propofol. So for sedation, it's midazolam and Phenargan with propofol. Antibiotic, yes, either augmentin or Monocef is given, as cephalosporin or augmentin is given. Describe the adult OT. What does that mean? Occupational therapy. How do you describe occupational therapy? If the occupational therapy is to make the child individual independent in their daily activity. So if in the individual is, we have to look at the level what the individual is and then work on the next level. So if the individual is very severe, then we work on activities of daily living. And if is well evolved, then we work on improvement in comprehension, general understanding, and ability to live in the outer world. That's how the adult OT. I'm not an OT specialist. I'm just saying from what I have seen so far. So she was disconnected. Whoever in India needs to go for 2 days earlier. No, Srinivasan. Those who are in India will send the reports a week or 2 weeks before. We will send them the investigation list, and they will send us the blood reports a week or 2 weeks before. Everybody gets admitted on a Sunday. So those who have not done the blood test, for those who have come from abroad, we will do the test as soon as they come to the hospital. When can we travel back to the hospital, to the US? Earliest would be the Saturday after the procedure. And if you're there for 2 weeks, then the Saturday after. I would say keep about minimum of 1 week or 2 weeks. The only time then sometimes return gets delayed is if the child has a spinal headache. So if we do 40-50 patients, 1 or 2 end up having a spinal headache. That's very unpredictable. We try and give a lot of fluids and encourage parents to give the child a lot of fluid, but still if it happens, then it happens. Thank you, James, for the appreciation. What is the difference in 1 week and 2 weeks? We will send you the video of this. As I said, 1 week you do cell therapy and then rehabilitation for 4 days, and in 2 weeks, along with rehabilitation, you get oxygen therapy, and that has to be 10 sessions. That's why it's a 2-week program. Once you get in touch with us, our coordinators and the doctors will give you a brief about both of them. So since I'm now going to log off, and thank you for patient hearing, and do send us any more questions. You can send it on email.